Hey, New Frontiers Health Force partners. This is Dr. Tonya Sopa Oling from Ngoswani, Kenya. Can you believe it? You are not gonna believe your eyes when you see this. I am standing in front of the Ngoswani Community Health Center. Now, it's not completely finished yet, but since April, it went from this ground being nothing to this 1,400 square foot facility. We still have a few things yet to do, but you guys, something that started 21 years ago as a dream had become a vision is now becoming a reality, and I want to thank you all for partnering. Now, I'm going to take you through the clinic at some other points, but the sun's setting, it's getting a little bit dark, and you might not see me. So in a little bit, through technology, we'll take you through the clinic and show you what our rooms are going to be like and what's going to be happening there. All right, bye for right now. Okay, I want you all to come with me into our clinic. Let me show you what's going to be happening here. On this side here, we're going to have the first of our exam rooms where patients will come in, and it will be a triage area where they will be weighed. They will get their immunizations for the children. The nurses will basically work out of here. Across the hallway here, and it's kind of dark, so I'm just going to point this out, is our reception area. This is where people will come and give their payments. We will keep all their records here. We're going to travel on down our hallway here. And you're going to see this room right here will be our exam room. We will probably use this room as a GYN room for women. It just happens to have the right amount of space to put these kind of facilities in the room. It has a storage closet. Across the hallway is our waiting area for patients. And then we have down the hallway here, which I'm going to go by, as you can see, the homemade ways that they do things. Down the hallway and on the right-hand side is our third exam room. So this is the first part of our clinic, the first half of our clinic. So come on with me. We are heading on over to the other side of the clinic. And my able-bodied assistant is on the camera. This room right here will end up being a holding emergency overnight observe room. We'll probably put 2 ward beds in here. If a woman should have a prolonged labor, we may put her in here. Should somebody have a very bad case of malaria and they need observation, we'll put them in here. So this is going to be kind of a little ward room. Directly across from it, this is our lab room. And we will have all the things that we need to have a good lab and patients to have the ability to be diagnosed. You might hear the tinkering in the background, and that's the goats. And I just want you to know, as you look out, well, maybe not. There they are. The goats will not be allowed to come into the clinic. Come, my able-bodied. Oh, we have one storage room here. And finally, this room that's filled with all of this construction materials will be our pharmacy. We will have the patients come. Where'd you go? Come back over here. Our patients will give us their prescriptions here. We'll take them from here. We'll fill them, and then we'll meet them on the other side where we will dispense their medicines. And then finally, well, we can't go through this door right now, I don't think. I think it might be locked. Help! No, we can't get out at this moment. But patients would finally exit this way and out into the front of the clinic. So guys, you know, I know right now it's still in the creative stages, but you can see that something that began as a dream 21 years ago is becoming a reality. And in effect, it is going to bless tens of thousands of people that will come from all over. I've been told as we've been here this time that people have been visiting from as far as Nairobi and Narok and other districts to come and look at this health center because they want to model other things by it. So guys, partners, family, thank you so much for your support. Thank you for what you've done to help make this a reality. We are hoping, if it stays on schedule, that next May of 2009, this building and all of the furnishings will be complete, and we will hold a huge ceremony to dedicate this to the Lord. I love you, and I'm saying goodbye now from Ngoswani, Kenya.